Hello, everybody, and welcome to today's success story, where we are going to be chatting with Cathy, who recently matched in the 2021 match. So, welcome, Cathy. Thank you so much for being here with us.
Thank you for having me.
Definitely. So, tell us a little bit about your match. What specialty did you get into and program?
Yeah, so I'm matching a categorical spot for general surgery at Tulane.
Great. And is general surgery your top specialty? Did you apply to multiple specialties?
Yeah, it's my top special. It's the only specialty I applied to.
Great. And what is it about general surgery that has made you interested in the field since starting medical school?
Yeah, so actually before medical school, I was kind of interested in general surgery already. I was shadowing a general surgeon at a local hospital. And it was just really amazing seeing the teamwork in the OR. When everybody, the scrub tech, all the way from surgeon to scrub tech to nurses, anesthesia, when everybody worked together as a team, this operation goes so smoothly, and I feel like everybody in the OR that I shadowed at was very like patient oriented, and they took care of the patient a lot. So that whole team dynamic really drew me to surgery, but also medicine. This is before medical school. So throughout the medical school, I'm just also kind of more drawn toward a specialty, and I really like operations. I love being hands-on. I had some great mentors throughout medical school. So that's what led me applying to general surgery.
And can you tell us a little bit about your medical school education background?
Yeah, so I went to University of Queensland, Ochsner Clinical School. That's a full title. So we're in University of Queensland, which is a medical school in Australia. It's
Okay.
a it's like a top 50 international medical school. They're very prestigious. But then we have a branch from it where we do our 2 years in Australia for the preclinical years, and then the second 2 years we do in New Orleans, which is where I am right now, at Ochsner Health System. So we do all of our rotation at Ochsner with some option to go away if we choose to.
And what made you choose that medical school specifically?
So I took a couple of years of gap year between undergrad and medical school, and I kind of explored everything that I wanted to do. So part of that was shadowing the OR, and I worked with kids with autism as well as a behavior therapist. And I also did a couple of other things, like I was a skydiving instructor and everything. So I really tried to explore what I wanted to do. Wasn't exactly sure. I know, and I wanted to do something medical long term, but I wasn't exactly sure if I would be a doctor or anything like that. So in the gap years that I took, I finally decided I want to be a doctor. So when I started applying to medical school, those gap years kind of, stood out to medical schools. So, but also because it's Australia, medical school was off cycle. We start in January and end in December because it's on the southern hemisphere. So they actually, after I sent out my first round of applications in the US, they had already got back to me with an interview and was a decision letter. So at that point, I kind of had a decision: do I want to test it out in the US medical system and kept on going with my application, or just accept this like phenomenal, agreement, like a acceptance letter? And I was born and raised in China. I lived in Canada and I lived in Florida for a lot part of my younger life, and I love traveling and I love the global medicine aspect of it. So for me, it was kind of no brainer to go to Australia to do medical school. It's on my bucket list to go visit Australia and live there.
Well, it looks like you got 2 years at least there, and then you were able to get 2 years of clinical experience in the United States as part of that education, correct?
Yes,
So
absolutely.
do
And
you see yourself,
sorry. I was saying that
sorry,
was very attractive for the program as well. I have a guaranteed 2 years of clinical experience in Australia, in United States.
right, exactly. So where do you see yourself in the future? Are you going to practice in the US, or are you going to go for more of the global health? aspect of things?
I absolutely love global health. So that's one big passion of mine, but I think I will be based in the US. I want to set up a practice in the US, but still be able to travel globally for some global medicine, maybe part of the year, or set up some sort of practice internationally as well in more volunteer basis.
hmm So, do you care to dive into that a little bit more? Like, what sort of aspects of surgery can you take into a global setting?
Yeah, so I haven't officially explored a whole lot of this avenue yet, but in Ochsner, some doctors, some surgeons go to South America or Africa, and they do take a resident with them as well, and they will go maybe 2 weeks at a time, a week or two at a time, and go once or twice a year to operate there or assist setting up some sort of surgical operation with a local community, and teach them and bring them new innovation tools. And a lot of times, I think you see in these like less advanced countries like India, Africa, South America, they not only they don't have access to these tools, but even if they do have access, they don't know how to use it. There are some people, there was a story I heard that they got a set of laparoscopic equipment and a camera setup and everything, but not a whole lot of people in that town are trained to do it. So a lot of our surgeons will go there for a couple of weeks out of the year, maybe a couple times a year, to teach the local community how to use it. So I think that's one aspect of global medicine is we want to set up something more sustainable. We don't want to do this global, they call it medicine tourism, where you show up, you do surgery for like maybe a week or two, and then you leave them with nothing. And there's like no sustainability. So I'm really trying to work in the part of surgical access to care. That's a part I'm really passionate about.
And did your residency program have anything like that when you were interviewing with them? Did they talk about potential opportunities?
Yeah, so that's a biggest attraction for me for Tulane is Tulane has tons of global health opportunities. So they have what I just talked about, where they have surgeon that'll go there like a couple of times a year and take residents to go with them. And they also have they're part of a sponsor. They're in a consortium called the Fogarty Fellowship. It's sponsored by NIH. It's a 1 year long fellowship that you go and do research in either South America. There's like 20 some countries that participate in this. And Tulane, UNC, University of North Carolina, Chapel Hill, and Johns Hopkins are the three schools in the United States that get together and sponsor this consortium and they have mentor all throughout. So I actually on Monday just sent in my CV to try to hook up with a mentor who can set up a project with me. And this will be something happening after the third year of residency for surgery for me, hopefully, if I get the grant.
Great. Well, good luck with that. We definitely hope it works out for you in that sense.
Yeah.
So, can you tell us a little bit more about your interview experiences, whether that was with Tulane or some of the other programs that you interviewed at? Was there anything particularly memorable or that stood out to you?
Yeah, so I mean, obviously this year just so different from any other year, but I don't know any difference since this is the only cycle I've been through. So we just have, all the story I hear, the most memorable typically is a night before where you had a meet and greet with residents. Um, so a lot of programs try to kind of emulate that and do a virtual mixer, which was pretty good. I really enjoyed that. Be able to meet a resident on a more social, relaxed basis. My favorite was a couple of residencies, including Tulane. They encourage you to bring your spouse, your children, your animal, whatever you have. I kind of introduce everybody in just a relaxed setting and chat freely, not so structured like a formal interview. And I really love that process. And I think it wasn't very hard to get a feel of what the group dynamic is like. You get to see how the resident interact with each other too, and that was a huge impact on how I, decide programs too.
So without naming any names specifically, were there any sorts of interactions that you saw that turned you away from, a program, for example?
Um, so I think the programs that didn't do, there was a few programs that I had zero interaction with residents. That
Uh-huh.
really turned me away because, I'd be spending my time with these residents for the next 5 years. I want to get to know them. But another red flag with that is if your resident doesn't have the time, because general surgery is always known as a pretty time intensive specialty, which I am definitely ready and prepared for that. But if your residents doesn't have the time to even come and meet and greet with a potential, fellow resident who's you're going to be working with for the next 5 years, um, in my mind, there might be some sort of red flag. Maybe they're way too overworked. They didn't even have time to come to a 1 hour or 30-minute mixer or something like that. So that's something I'll look for as well.
Yeah, I think that's a really interesting observation because some programs have different standards and procedures for the interviews, and the ones that put themselves out there, or we're sending the videos to help show people the surrounding area or the hospital and having these mixers. I think you're totally right in that that helps give potential applicants such a better understanding and comfort level with applying. So was there something else that was unique about your application circumstances, like in terms of potentially like the rank or match process?
Like my personal app as an applicant, or my just whole process in the application
Um,
put
for
out.
example, did you go through the couples match?
Yes, yeah. So I went through a couples match. At the so actually, I think it kind of can help you. It's a little bit intimidating going through couples match at first when you didn't quite understand the process. But as we're going through the process, I find it not very, it wasn't a hindrance at all.
Can
Um,
you tell us a little bit about the process and what might be different by going through the couples match?
yeah, absolutely. So when it comes to application and interviews, it really isn't much different. You still apply to your specialty, and my partner applied to his specialty. And we both got interviews offers separately, just like anybody else would. One thing that really helped us in that aspect is so he's from the same exact school as I am. So we both are US IMGs, technically. And the one thing that really helped is for the program that I got an interview at, I immediately messaged the program coordinator that gave me an interview and tell him about my partner, and found he matching pediatrics. So I found the pediatric residency at that program. And if they don't have one, I find the closest one, and gave them the contact information and see if they could coordinate with them to give him an interview as well. And he did that for me too. So I think going through that process, we probably got maybe 3 to 5 total extra interviews between the two of us. So I do think that's definitely a big help. And even from the NRMP preliminary data year after year, couples matching rate is slightly higher, maybe like by 1% or so higher than non-couples matching. So a lot of people go through the couples match, think it's really intimidating and it might be a hindrance. And I definitely stressed out a lot over it. But end of the
Yeah.
day, I think it's not, it helps, and it doesn't really negatively affect you very much at all.
So if you had to go through the application process again, is there anything that you might change about what you did throughout the season?
Um, so I think I was trying to stress a little less. So I going into it, of course, I remember first maybe 3 or 4 weeks, I was just sitting there checking my email every 15 minutes, thinking that I'm getting an interview. And the first 4 weeks, I got only two interview in addition to the ones that my program provided me. And I was very nervous, and I was trying to like figure out, what's going on with my application. And even before going into it, I knew I did all I could personally. To strengthen my application, but it still was very stressful not getting interview. And eventually, rest of the season, the interviews start trickle in. It was fine, but I definitely stressed out a lot more in the beginning, and that I don't think that was very healthy for my mental health for a little while there. So that's definitely one thing. Maybe going into the interview with a complete package that you're going to have a complete package, and go in with a little bit of more confidence and just sit tight and don't stress too much.
Definitely. So when did the interviews start coming in more consistently for you? Like what month? Do you remember?
So I think it's mid-October. Mid Yeah, I think mid to late October, I was still getting interview invites. I think my last interview invites was maybe even like mid November. I was still getting some interview invites. Um, but definitely the bulk of it came, I think, in around week 6 of URAS Open is when I got the
Uh-huh.
week 5 to 7. Those 3 weeks, I got the most of my interviews. The first 4 weeks, I got
And
barely anything.
yeah, so basically you're saying don't stress out in the beginning if you're confident in your application, and you just have to give it a little bit of time and patience, and then hopefully those interviews will start coming in.
Yeah.
When you got to the interviews, did you feel prepared, or how did the interview process go for you itself?
So my home institution did the first interview. They tried to get in the very first interview very early on with us, so that we can be as prepared as possible for interview days with other programs, which I found that quite helpful. Um,
Hmm.
just as a practice run with everything. Um, my very first non-institutional interview, I was a little bit like, stressed out because I didn't know these people. And also that interview had a lot of, I remember a lot of situational questions.
Uh-huh.
Like if this happens, what would you do sort of questions. And there was a lot of them back to back to back versus a normal conversation. And after that interview, I had thought all of the interview must have been like that. So then I went on the website, I went on like Reddit and all the different platform where people post their interview questions. And I made like a 3-page long Word document of question and answer format. And after that, I probably maybe got 3 more questions throughout the entire rest of the season. So I do remember that was a little bit stressful. I think situational questions, although I try to prepare for it, but you just can't. It's hard to prepare for. They can really ask you just about anything. I didn't get asked this personally, but I know someone has gotten asked if they were a kitchen appliance, what they would be. Um,
Huh.
so like, you can't prepare for that. You just have to, and why, like you need to explain why you want to be a certain kitchen appliance. Or like if are you a weed or orchid and why? So it's really hard to prepare for those things. But yeah, just going with an open mind and a positive attitude. I think that's what I did for most of the rest of my interviews. And I think that went pretty well.
Yeah. And did you use any other application support services or mentors to help with the application process?
So I reached out, I used Matter Resident to earlier on to kind of rank to see where I'm standing with these schools. Because like Matter Resident had that score that will tell
Mhm.
you if you're 100% likely or like down to whatever 70%. They give you that top bracket of where you're most likely to match. So I used that a little bit at the beginning. And then throughout my interview, I did go back. If I cannot find additional information from like Frida or Resident Explorer, I'll go back to Match a Resident and look at some of the interview experiences from that season for the programs that I'm interviewing at. And for my application itself, I thought out pretty much advice from like anyone. I remember going to a conference, AMSA conference, American Medical Student Association, early on, like I think in March. And one of the advisor there, she's a PD in OBGYN. And she offered, like, if you want to send me your CV or send me your personal statement, I will look at it. So I wrote down her name, her number, and when I have my CV and personal statement done, I send it to her. Because she's an OBGYN, not even in the same specialty, but I still, send it to her, and she gave me some really good critiques. And I send that to my personal PD. I send it to my mentor to look at. I must have my personal statement looked at by at least 6 or 7 people. And they're all, some are physicians, some are just my friends, and some are professional. I didn't pay for it, but my local institution offered a professional kind of CV editor service for free for us. So I used them as well. So I had a lot of eyes on my whole application.
And did your personal statement or ARIS application come up during the interview process as well?
Yeah, I mean, definitely the ERAS, the application, I mean, people will keep drawing from it. The personal statement, it actually did. It came up a bunch because, I wrote about growing up in China. I wrote about my experience in Australia. So those are what almost every single program has mentioned something about that.
Right. Yeah.
Yeah.
So getting all that help with creating it and having people review it and make sure that it was very on point and appropriate and professional was very helpful, it sounds like.
Yeah, it's definitely very helpful. There is one caveat or downside though, getting so many people looking at your personal statement is that everybody has an opinion. So
Uh-huh.
somebody think you should do it this way, but then another person will think maybe you shouldn't do it this way. And everybody has a reason to it, and it all sounds great. So you obviously can take everybody's reason, like everybody's version, because a lot of them clashes. So you just really have to also know what is you. So that's a one downside of having so many people looking at it. And at the end of the day, it boils down to like, is this advice still make this personal statement sound like me? Because I'm not going to pretend to be someone I'm not when I go into my interview.
Yeah, it sounds very difficult to be able to filter through all that different advice sometimes, but I think what you said about just sticking true to yourself and making sure that it's really your voice that's coming out at the end is really key to making sure that your personal statement is truly personal.
Yes, absolutely.
So for your residency coming up, is there anything in particular that you're looking forward to over the next, 5 years of training?
Yeah, I'm just looking forward to starting and meeting all my co-resident. I already met a bunch of them on my interview trail, and many of them reached out through email after the match. So definitely very excited to work with them. And I already talked about my upcoming, hopefully getting this NIH grant to go to Africa for a year. So I'm definitely looking forward to that. And also just practicing, I think taking on more responsibility. It sounds scary too for me, but it also is very exciting to be able to finally put the 4 years of hard work to practice and
Amazing.
actually start, yeah, caring for patients. That's very exciting.
It's the next step and it's waiting for you and it's there, so close.
Yeah,
Perfect.
absolutely.
Do you have any final pieces of advice or wisdom from your experience through the match process to leave everybody with?
Yeah, I think the final last bit is just like be yourself. I know I already said this before, but be yourself. Um, in your application, in your interview, I think it's very easy to tell when someone's stiff and awkward and they're not being natural or they're trying to hide something. And I know sometimes, and it's hard as a IMG as well, because you kind of you're always feel like you need to compensate for being an IMG. So you try to
Mhm.
put up a front. But everybody knows, like, we're all human. We all have some sort of downside to our interview. Not everybody is 100% perfect, but it's as long as you can explain and know what you learned from the process. I think every single, not even mistake, I wouldn't even say mistake, but every single imperfection can be a learning opportunity. And I think if you just accept that and be yourself and learn from any past experiences, that's a key point of being a more well-rounded person, and it'll show through your interview process for sure.